Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, distinguished panelists, fellow researcher, and participant. I'm Ayu Shabrina from the Faculty of Pharmacy, Universitas Wahid Hasyim, located in Semarang. It is an honor for me to be here at the UNICOPPS to present my research entitled Nanoemulsion-Based Enhancement of Celecoxib Topical Efficacy optimized via Central Composite Design. So this study addresses a critical challenge in topical drug delivery, improving the solubility, permeation, and therapeutic performance of Celecoxib as an anti-inflammatory agent, known for its poor solubility and limited bioavailability. So I hope that I can contribute valuable insights into nanoformulation and demonstrate the potential of optimized nanoemulsion to enhance the clinical utility of poorly soluble drugs. So here is my poster. All right, so NSAID are Indonesia's first line osteoarthritis treatment. This treatment can produce gastric ulcer, especially in geriatrics. A strong association exists between NSAID use and gastric ulcers in geriatrics. Celecoxib is one of the NSAID that has low gastrointestinal side effects, and previous research found that neither celecoxib nor NSAID prevent ulcer recurrence. Celecoxib has limited solubility and bioavailability, and several methods can promote solubility and skin permeation, including nanoemulsion. This system has immiscible liquid phase dispersion with a droplet size below 200 nanometers. And nanoemulsion is an innovative nanodroplet method for systemic, controlled, and targeted topical drug delivery. This method avoids hepatic metabolism for systemic circulation. Surfactant and co-surfactant mixture are crucial to nanoemulsion formulation, and the surfactant can increase the skin permeability by disturbing the stratum corneum, while the co-surfactant also can reduce the droplet size and also reduce the interfacial tension and bending stress. Surfactant type concentration greatly affect nanoemulsion droplet size, and smaller droplet size can also increase the absorption and bioavailability by increasing the surface area. And this work employed Central Composite Design to discover the best Celecoxib nanoemulsion formulation by adjusting the surfactant and co-surfactant to improve skin permeability and efficacy. So here is the material. We used pharmaceutical grade of Celecoxib obtained from Hong Kong, and other chemicals were Trinity, ethanol 69%, and phosphate buffer. And we studied the effect of the Trinity and ethanol mixture in 4 variables, including pH, transmitted percentage, droplet size, and polydispersity index. So we produce Celecoxib using ultrafluorex at 3,000 rotation per minute. So Celecoxib was dissolved in ethanol using the ultrafluorex, and then nutmeg oil was added, and then Trinity was also added to the mixture and homogenized for 3 minutes using the ultrafluorex until a clear and transparent nanoemulsion was formed. And then we characterized the physical of the nanoemulsion, and also we test the effect with in vivo and also the in vitro permeation test. So here is the result of our experiment. As you can see here in the table, the experiment indicated that the lack of the test was not significant, with the p-value exceeding 0.05 based on the analysis of its statistic here, and it can be concluded that the response of the transmitted percentage, pH, polydispersity index, and droplet size has a good modeling. So here is the 3D models. As you can see here, the Trinity and ethanol combination in the formula can increase the transmitted percentage, resulting a clear and transparent look of the nanoemulsion system. And the increasing of both trinity and ethanol can also reduce the droplet size, and the increase of the ethanol alone can increase the pH because the ethanol concentration can alter the ionic balance, so potentially leading to an increase of the pH value. And the mixture of surfactant and co-surfactant influences a minimum response and polydispersity index, indicating that this combination exerts a minimal effect on increasing the polydispersity index so that the formula was monodispersed. And the optimized formula also show the highest flux, as you can see here in the in vitro result test. This is due to the small droplet size of the nanoemulsion, which facilitated the preparation passage through the epidermis membrane. And this in vitro result also connected to the in vivo result based on the pore edema test. And the optimal formulation can effectively minimize the pore edema compared to the conventional emulsion or any other mixture shown here in the figures. And the last one, we can conclude that this optimized formulation containing nutmeg seed oil as a carrot oil, trinity as a surfactant, and also the ethanol 96% as a co-surfactant exhibited the optimal physicochemical characteristic, as you can see here in the figures, and also superior in the in vitro and in vivo performance. So this optimized system shows a strong potential as a topical delivery platform for Celecoxib, granting further pharmacokinetics and pharmacodynamics evaluation. And the last one, we would like to thank the Ministry of Education, Cultures, and Research Technology for the funding in 2024. And we also thank the Faculty of Pharmaceutical of the IIUM for providing us the microscopy analysis. And for the reference, you can scan the barcode here, or maybe you can type the link here. So thank you for your attention. I hope that this research can contribute meaningfully to ongoing efforts in formulation, innovation, and support further exploration of nanotechnology-based approach for safer and more effective therapies. And I'm very open and welcome any question or feedback from the panel and also the audience. I'm also open for a research collaboration as I'm a head of the research center in Universitas Wahid Hasyim. So you can email me stated in the poster here. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.